It's me again. So this is fundamentals, and we're going to do chapters 1, 2, and 3 in one video because I think that that's going to make the most sense. So chapter 1, the origins of nursing. So we'll talk about the things that you need to know. And I will tell you, nurse, from the Latin word meaning to nourish, right? We are a very noble profession. You have to have a strong sense of responsibility, highest standards of integrity, personal conviction, flexibility. It's an art and a science. I say that all the time. And there's so many different venues and specialties that you can get involved in. So, there's so many possibilities with nursing. Back in the day, they believed that sickness was a punishment by evil spirits. They had different types of teaching. They worshiped the sun and the moon and so on and so forth. About 500 BC, the Greeks started to acknowledge causes of disease and established hostels, which were the first hospitals to take care of sick people. So they were really the founders of this system that we know of today, kind of. There are symbols of medicine that we're all kind of familiar with. I will tell you that the caduceus, which is the smaller one on the left or on the right, B, you should know what that is. I love that symbol. Even though it's based on mythical creatures, it still holds near and dear to my heart for the field of medicine in general. Okay. So Hippocrates, Greek, he was the father of medicine. He was the one that emphasized how important it is to take care of a whole person. And he was the one that kind of laid the groundwork for modern nursing and physicians and medicine in general. Basically, the Florence Nightingale pledge, and there's a practical nurses pledge too. They're both based on the Hippocratic oath, which is the oath that physicians take when they become physicians. So we're not going to get into all of the heritage, but there were, military nursing during the first century. During the Crusades, there were male military personnel who were actually the nurses. And that was the groundwork for the nursing pins that we wear today, because the guys that were the nurses during the Crusades wore a pin that was the Maltese cross. And then everybody could tell right away that they were the nurses. During the Reformation, which was about the 1500s to the 1800s, monasteries, which is where the religious people resided, they were closing. Few women who provided care were either prisoners or prostitutes. Okay. And nursing was considered the lowest of the low. Okay. It was the dark ages of nursing. In 1836, some guy, Pastor Theodore Fliedner, established the Kaiserwerth School of Nursing. It was a Lutheran, it was religious based, right? And the most famous student he had, Florence Nightingale. Okay, Florence Nightingale, and we're going to talk about Florence. Is the following statement true or false? Hippocrates helped lay the groundwork for modern nursing and medicine. If you said true, you would be right. He's the father of medicine, we call him. Now, Florence Nightingale, what do you need to know? You need to know about Florence. She is the one that's responsible for that image of the lady with the lamp. That's actually her nickname, right? She's the lady with the lamp. She went to the war scene during the Crimean War and was instrumental in saving so many lives because of, cleaning things up, establishing sanitary conditions, and really providing high quality nursing care. So the number of deaths significantly decreased because of her. She had a lot of progressive ideas about nursing. One of her quotes, nursing, quote, ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient. So we take care of the patient, okay? And she made a lot of sense even back then. The Nightingale School, first school that opened outside a hospital, was a one-year program, classroom and clinical, and it emphasized learning over service to the hospital, because prior to that, nurses used to have to stand up when physicians entered the room. They cleaned the floors, they brought in coal to heat the buildings. Before this, nursing, like I said, was very menial. This is when nursing started to change into more of an educated and more professional field, okay? And Nightingale principles that are still taught today, well, should be. Prevention's better than cure. I agree with that. We are members of a team. Absolutely, we are. The nurse must use discretion, but I want you to make note that I crossed out must follow the healthcare provider's orders. That is not true. It is up to you, the nurse, a licensed individual, to be certain that the orders that you receive are good, in fact, orders, that there's no medication errors, no dosage errors. Doctors are human. Doctors make mistakes, right? Human beings are fallible. So you, if anything were to go wrong, and God forbid you went to court and the lawyer asked you, why did you do that? You can't say, well, the doctor ordered it, because their response is going to be, you are a licensed personnel. You have to be making sure that the orders are appropriate for the patient. So good nursing programs encourage a nurse's individual development, and you need to be healthy in mind and body. So you must practice self-care. Okay. Teaching is part of what we do as nurses, right? Nursing is definitely a specialty. And nurses graduate. Says here, nurses don't graduate. We graduate, but we never stop learning. I've been doing this for 35 years and I learn something new all the time, right? So nursing curricula, in other words, a nursing program, should include theoretical knowledge, which is lecture, and practical experience, and that's clinical. Okay. The Nightingale School, what else did they do? They established a nurse's residence. They had like a dormitory where they would stay. And they were the first ones that had entrance exams, right? And they needed character references. So this was the groundwork for nursing as we know it today. So just make sure so far that you know Florence Nightingale, the lady with the lamp, she is the mother of nursing, really. Is the following statement true or false? Florence Nightingale schools emphasize the importance of providing service to the hospital. That answer is false. She emphasized the importance of learning. Knowledge is power. Remember that. Okay. Some of the first nursing schools in the country opened in about the 1800s. Pittsburgh Infirmary, which is Passavant Hospital, and a lot of them were religiously based. Bellevue in New York, Connecticut in New Haven, Boston Training School at Mass General. So who else do you need to know? They're highlighted. Make sure you know who Dorothea Lynde Dix was. She was one of the instrumental ones who campaigned against inhumane treatment of mentally ill. In the 1800s and even through the early 1900s, mentally ill people in this country were not treated great. It was common practice to institutionalize them. And it was also common practice to do something called a lobotomy, a frontal lobotomy, where they would surgically go in and remove the frontal lobe. And basically what you would have left is a shell of a human being, just a zombie. And other horrible things that went on back then with mentally ill people. Dorothea also recruited volunteer nurses to help treat men that were injured in the Civil War. So make sure you know Dorothea. Okay, the board may ask you about her. Okay. We are going to skip ahead to Lillian Wald. She was the founder of American Public Health Nursing, and she's the one that convinced New York City schools that they needed a school nurse. Okay. She also was instrumental in getting President Theodore Roosevelt to create the Federal Children's Bureau and insisted that nursing education occur in institutions of higher learning, not hospitals. Okay. So again, this is how it was progressing to where, we were actually becoming more and more educated. Okay. So pioneer schools, you don't really need to know that, but it's very interesting. The YWCA opened the first practical nursing school in Brooklyn, and it offered a 3-month course in just basic nursing care. Thompson Practical Nursing, Household Nursing School. So there were many schools that started in the late 1800s, early 1900s. You can see here milestones with practical nurses, which is what you guys are going to be. Let me just pause my recording for one moment. Okay, sorry. So, milestones in practical nursing. In 1908, the American Red Cross started offering home nursing education to teach women how to take care of their families that were sick. 1914, Mississippi became the first state to designate the title LPN. 1917, U.S. Congress passed the Smith-Hughes Act that promoted vocational, technical, and public education. So, vocational schools like the one that you guys go to here, that's when that started. 1919, the first vocational school-based nursing program opened in Minneapolis. 1941, Association of Practical Nurse Schools was founded and changed the name later on to the National Association of Practical Nurse Education and Service. All very interesting, but no one is going to test you on any of this. So I'm not going to go on. You can read the PowerPoint if you are so inclined. But nurses have been, on the front lines for years and years and years. What's going on now currently? Well, patients are getting discharged sicker and quicker, higher client acuity in hospitals and even in long-term care. Lots of technology now that's being used. Telehealth is a big thing, especially since COVID, it's really taken off. Lifestyle factors are a big determinant of health, and greater life expectancy, not necessarily. Actually, our life expectancy right now has kind of plateaued. So, and that's has a lot to do with the increase in type 2 diabetes and our sedentary lifestyles, but we'll save that for another lecture. Changes in nursing education, not really, but the doctorate degree, which is a terminal degree in nursing, is something that's gained popularity, but only 1% of the entire population of this country has a PhD or a DNP. The nursing insignia is the lamp. So at graduation, you will get a lamp, the Nightingale lamp. And that's the standard of nursing. That's when we see that, we think of nursing. Nurse uniforms. One of the big complaints patients will have is that I don't know who the nurse is, who's the doctor, who the aides are, who's housekeeping. It's really important that nurses are identifiable and name tag with a photo. Really important. And then, of course, the pin, the nursing school pin. Sometimes you'll find pins that are the Nightingale lamp, but there are lots of other types of pins. I have a whole collection of pins that I've, collected over the years of my being a nurse. The pinning ceremony is a very important piece of the graduation for nurses. It has a lot of tradition in it, and it's very, very meaningful, very meaningful. All right, here's a question. The responsibilities of the nurse have increased as a direct result of the increase in life expectancy. That's part of it. Part of it. Life expectancy, increased, but it hasn't right now. But there's growth. There's so many different venues. There's research. There's long-term care. There's subacute. There's acute. So many things. Pediatrics, maternity, et cetera, et cetera. So, nurses now have more responsibilities. You're licensed. So that increases your accountability. And it's important that you always maintain integrity and try to do the right thing. Okay. I have included the Florence Nightingale Pledge. I just love this. This to me is the most meaningful part of graduation. And here I have included a link that will take you to the State of New Jersey Board of Nursing legislature, the Nurse Practice Act, which defines what is our scope of practice as nurses. Okay. So that is it for this chapter. And we're going to move on to chapter 2. Chapter 2 is the beginning of your career. Let's get to the beginning of the PowerPoint, though. Okay. Beginning your nursing career. So roles are changing, lots of factors. There's always new discoveries in biomed. We learn something new every second. Textbooks are basically obsolete the minute that they're published because new information is coming out every second. And there have been changes in services and payments, and I don't want to talk too much about that, but insurance companies have had an impact. Remember the term multidisciplinary team or interdisciplinary team. So for the most part, nurses, physicians for sure, dietitians for sure, right? Infection control for sure. So these are all members of the team, right? Unit clerk, whether you're in a hospital, long-term care, occupational therapy for sure, Physical therapy, for sure. Pharmacist, we need our meds, right? Social worker, absolutely, to help us because we can't do everything. Speech therapy, absolutely. And respiratory therapy and risk manager, right? So all of these are part of the team. But as far as nursing is concerned, the ones that you're probably going to work the most with are the ones that I've highlighted. Okay. And no, you won't be tested on that. Okay. Okay. Going to skip ahead. Different types of nursing programs. So you can have a program for unlicensed assistive personnel. In other words, certified nursing assistants, home health aides, and then licensed vocational or licensed practical nurses. You guys, registered nurses, and then advanced practice registered nurses. Okay, nurse practitioners. So registered nurses, education is usually anywhere from a 2-year program to a 4-year program. 2-year program, you can get an associate's degree and get your RN. 4-year programs lead to a BSN, a bachelor's degree in nursing. And then if you want, you can move on, get your master's degree. I did that. And advanced practice nurses need a minimum of a master's degree. They can get a doctorate degree, but minimum of a master's. And they can do pretty much what doctors can do. They can assess, they can diagnose, they can treat, they can prescribe medications. But in this state, they're not independent yet. They have to work with a collaborating physician in the state of New Jersey. Now, that may change. We hope that it does. But for right now, they're not completely autonomous. Okay. Practical nurses, LPNs, licensed under state laws, just like RNs, right? You guys work under the direct or indirect supervision of an RN or the doctor, right? Or the nurse practitioner. You will supervise aides, nursing assistants, and you can do pretty much almost everything that RNs can do. You can do IVs, you can do wounds, bedside care, administer medications, monitor client. There are some things that the Board of Nursing says that you can't, and really they say you cannot initiate patient education. So in other words, you cannot start a plan of care. You can add to it, contribute to it, but you can't start one. And you cannot do a complete head to toe assessment like for an admission, although you probably will, you definitely will when you start working, as long as there's an RN kind of to oversee things. So, but other than that, there's nothing in the Nurse Practice Act that specifically prohibits LPNs from doing anything else. Okay. Education is vocational usually, which is what you're doing. They say there's a shortage of nursing instructors. They're not kidding. And most LPN programs are 12 to 18 months, and it's usually a full-time kind of a gig, right? A nurse who receives additional training in a specialized field like pediatrics or maternity is referred to as, I hope you said advanced practice nurse, because that would be it, okay? All right. Nursing programs, nursing education. So nursing programs like the one that you are in right now must maintain educational standards defined by the state that we're in, have to have approval from state agencies. We are approved by the New Jersey Department of Education and the State of New Jersey Board of Nursing. Have to be updated on a regular schedule, which is true. And we're protecting the public from unqualified nurses. I know I am. There's a minimal standard that is required for your education. And you can't get a license if the program's not approved. The program can't be operating if it's not approved. So we are approved, like I said, New Jersey Department of Education and the New Jersey State Board of Nursing. So accreditation. Accreditation initially is provided to programs by the Board of Nursing, usually for the first 1 to 2 years. And then private accreditation can be gotten after that. So there are accrediting bodies out there. ABHAS, ASSET, many different accrediting bodies that accredit schools of nursing, CCNE, AACN. I could go on and on. And the medical field loves initials. So, so accreditation is good because it shows that the program that you're in has met that higher standard, right? So you're in a good program. I talked about the Nurse Practice Act a little bit. Those are the laws that the state tells us what we can and can't do. And you should always read your Nurse Practice Act so that you are familiar with it. And then, of course, once you're done school, you have to pass your boards, also known as the NCLEX, National Council Licensure Examination. And that's for graduates from an approved nursing program, just like you guys will be. Okay? So, to get a license, mandatory licensure. Yes, in order to be a nurse, you have to get a license. A license designates what you can do and allows you to have the title nurse. Endorsement is an agreement between states, like State Board of Nursing from state to state, and reciprocity. So if you have a license, say in New Jersey, and you want to get a license in Pennsylvania, usually there is reciprocity. You just pay the fee and you can get a license in another state. But now that there's multi-state licenses, it's kind of obsolete. But lots of nursing theorists, if you go on and pursue your RN, you will learn about all these. Dorothea Orem, Sister Calista Roy, Betty Newman, Virginia Henderson, Florence Nightingale. These nurses came up with theories that help us in our nursing practice. But I'm not going to get into those right now. What do we do as nurses? We are care providers, teachers, leaders, team members, communicators, and client advocates. And don't forget that. Sometimes you're the only voice for your client, for your patient, okay? A nurse ensuring a client understands informed consent is performing which duty of a nurse? So, client advocate, okay? So it's really important. You're going to be doing a lot of talking during your career, okay? And just some of these things, not going to be tested on them, but you should know. We must project a professional image. We must be respectful. We must always be put together in a way that's clean and neat. I love how they say wear washable uniforms of appropriate length. I don't think anybody's wearing a white uniform to work these days. Maintain your safety, hygiene, and protection, PPE, right? And take care of yourself. Practice self-care so that, you can take care of others. Today's nursing students are very diverse. Many of them are adults, just like many of you, that have responsibilities, home, kids, jobs, those kinds of things. And sometimes you have to learn to juggle those things. When you're thinking about study doesn't have to be the traditional, I need a quiet room. So you have to be more creative when you have a job and you have children and you have a home and responsibilities. It's challenging, but it is rewarding when you complete the feeling of accomplishment. When you complete the program I can't even tell you, words can't explain. You'll see, okay? Nursing organizations. So there are quite a few now, nursing organizations out there. They are chances for nurses to kind of network with our peers. Some of them are very influential in politics and public policy legislation. I will tell you that the one I do want you to be aware of, although there are many, is the American Nurses Association, the ANA. And it's RNs and LPNs, and they are kind of the voice of professional nursing in this country. They have a lot of pull with the government. They are the ones that wrote the Code of Ethics, which was then adopted by almost every single state in the country by their boards of nursing. They have a lot of clout, the American Nurses Association. So important to know who they are. I am not going to get into the International Council of Nursing. So we are done with chapter 2. And now we are going into chapter 3, which is the healthcare delivery system. And again, there's not a lot here that you need to know. But, healthcare is changing. It's been changing, not necessarily the best, but it is changing. We refer to our people as clients now, not so much patients. We look at this as a service-based industry, so customer service is important, but the science, of course, is very important as well. Preventative services are super important, like immunization programs. And that's where this is going. Prevention, an ounce of prevention is worth a pound of cure. Okay. So trends are using more preventative services, using care plans that are also called critical pathways. That is important. That helps us establish goals for our patients, and to see if they are recovering in a way that's, kind of in step with the average person. There's something called social determinants of health, which have been being examined for quite a few years now to help decrease inequity in the provision of healthcare. So, in other words, whether you're rich or poor or where you live should not matter. You should be entitled to good quality healthcare. And there are lots of discussions, especially lately, about healthcare insurance providers, and their practices, but that's something we will talk about another day. Let's move on. The Affordable Care Act, the ACA, that was major healthcare reform. It was a big deal that, Barack Obama did. It was a big deal. They did institute the individual responsibility to have health care, but that has since been done away with. So you see that I put a line through this down here. But there is a healthcare exchange. So everyone should have the opportunity to get health insurance. Okay. The nurse's role is changing. We are getting more education than we ever were before. We are really, working as a team with the physicians. You really need to be able to understand the value of having not just well-educated staff, but people who care. So it's twofold. That's why it's an art and a science. We need people that have a good, solid foundation of education, and we need people that are empathetic and caring, because this is all about taking care of other people's lives. It's a big responsibility. Okay, it really is. Big responsibility. Healthcare settings. If you hear me say acute care facility, that is a hospital. Okay. Acute care facilities, subacute is not acute, so let's get rid of that. So a subacute is like a rehab, right? Also called steep down units, no, step down units. Usually what will happen is if a patient's in the hospital and they're in intensive care, they will transfer them before they send them to a regular floor, they'll send them to a step down unit. Subacute care facilities can also be independent, like long-term care and subacute, like a rehab. There are outpatient centers, especially outpatient surgery centers that do same-day surgeries, and it's all about the healthcare industry saving money. So we won't talk too much about that. There's home health, there's private duty home health, and there's Medicare certified home health, which, is a wonderful thing to make sure that patients get the care they need even when they're not in a facility. Hospice is near and dear to my heart. We take care of terminally ill patients, make sure that they are able to die with dignity, and not be in pain. Respite, the word respite means giving a break to a family member caregiver who's taking care of someone who needs care 24 hours a day. Hospice will provide for respite for caregivers, like family members who are taking care of their terminally ill family, so that, we'll put the patient somewhere where they'll get 24-hour care and give 3, 4, 5 days off, if you will, to the family member. Telehealth. Boy, since COVID, telehealth has taken off, but telehealth's been around for a minute. So telehealth uses some technology, and I love technology. I was one of the first ones to initiate telehealth for congestive heart failure patients. Did that down in Florida back in 2004, long time ago. McKesson Health Buddy, it was called. It was a machine. It went into the patient's home, hooked up to their landline because everybody had one back then. And it had a scale and it had a blood pressure cuff and pulse ox. And it would go off in the morning at a specified time and say, "Good morning, please step on the scale." And it would direct the patient to go through taking their blood pressure, pulse ox, weight, and asking them some questions about how they feel, and send that to me directly, and I would review it. And preemptively, if they were going into an exacerbation of CHF, I would be able to intervene and maybe prevent hospitalization. Telehealth now, we can see our doctors via telehealth, kind of like Zoom. It really does improve outcomes because it increases accessibility to healthcare providers. Extended care facilities, we're talking about long-term care nursing homes. That's all I'll say. Community health, public health, and healthcare in schools. So, so many different venues, I am going to skip ahead to this quality of care. Quality of care is a big, huge issue. We are responsible to provide our very best when we're taking care of our clients, patients, right? It is important that we always remember that. If we work in a hospital, hospitals do get accredited, and they are accredited by the Joint Commission. We call them JACO. They are the ones that accredit hospitals. And they go in and do kind of like a state survey, only it's a private organization. And they look at, the policy and procedure, and they go around and check to make sure everything's being done in a way that it should be done, that maintains the highest standard for the patients. QA, quality assurance, is in every type of healthcare venue. They're the people that kind of they focus on how we deliver care and how the outcomes are. So in other words, what's the result of the care we provide? Are we providing such great care that the patient gets better or things have improved? Okay. So QA, you will hear that a lot. Quality assurance and risk management is another piece of it. We'll get to talk about that later on. So standards for quality assurance, we have standards for our nursing practice. We have standards for our client care. There's standards of performance. We have peer reviews where we can review each other, and then nursing audits where, our documentation can be reviewed to make sure that we're doing the best job that we can. Some nurses are client advocates or concierge services. It's a private service to try to help them navigate through the healthcare system. And then there are also state representatives like the ombudsman. Ombudsman is the person that you would contact if there were a problem with a resident in a nursing home. And they're appointed by the state to intervene and try to investigate what's going on if there's a problem with the quality of care in a nursing home. Ownership of healthcare facilities, venture capitalists. We'll keep this short and sweet. Some hospitals are funded by the government, like public facilities. Some hospitals are privately owned. It doesn't matter if a facility is for-profit or not-for-profit. A not-for-profit status, a 501c3, is just a tax shelter. So they're making money. Promise. Costs are a concern, I think care is the bigger concern. I'm not even going to get into this, but I think that overall we are doing an okay job. I think we could definitely be doing a better job, especially insurance companies kind of have a stranglehold on this country. The different types of insurance I will explain to you, but I will not test you on it. So when you have private health insurance, you either have a fee-for-service plan. In other words, I pay the insurance company and they give me an insurance policy or a plan that helps cover whatever my needs are. Then you have HMOs, health maintenance organizations. I pay a fee every month, whatever the premium is, and I have to go to who they tell me I can go to. I have to get approvals for everything, pre-auth authorization. PPOs, preferred provider organizations, that's kind of a step above an HMO, and point of service plans, POSs. They are a step above HMOs. They allow you more flexibility to see who you would like to see rather than, an HMO, which tells you who you can see and who you can't see. Then we have Medicare. Medicare is the best, and that's socialized medicine, and it works. People in this country that are 65 years of age or older or a little younger than 65 but permanently disabled, or end-stage renal disease are entitled to Medicare. And Medicare has a Part A, that's your hospitalization, a Part B that covers physicians, and then a Part D for medications. Okay. Medicaid is for low-income folks. I was on Medicaid years ago. It is what it is. It's better than not having anything. Okay. So, federal government oversees Medicaid. The Centers for Medicare and Medicaid Services is a federal institution. However, they have kind of put the responsibility back to the individual states to determine Medicare or Medicaid eligibility and what Medicaid will cover and those kinds of things. So, money. I'm not going to get into prospective payment or DRGs. I think that that's quite enough of this. I'm going to just move here to the very end and just make sure as nurses, and this is the one thing that I will test you on, and the one thing out of this whole chapter that you must know. There's lots of bad information out there. People are misled all the time. Oh, we have a cure, and when people buy into these snake oil salesmen, oftentimes it delays real treatment and it's too late to save the person. The general public most of the time can't tell the difference between what's true and what's false. And the people that sell these things, take this vitamin, it will cure your cancer. They are very convincing. They're also very evil, my opinion. So as a nurse, it's our responsibility to make sure that our clients have all the facts, only facts, right? So it's very important, science-based facts, right? If you suspect someone's committing fraud, report it. Anybody that's claiming anything that can fix a disease or cure a disease or any healthcare claims should be supported by empirical research. If they are not, and I'm going to throw in here that supplements, over-the-counter supplements and vitamins are not overseen by the Federal Food and Drug Administration. So there's no evidence supporting their claims. You want to make sure that you're allowing your clients to get facts and only facts. Only facts. It's our responsibility. Okay. We are the safety net, sometimes the last safety net between the patient and the grave. Okay. And don't forget it. Okay. Take care of your patients. Take care of yourself. That's the end. Until next time, I will see you later. Okay. All right.